All right, so thanks everyone. So today we wanted to have this call, and we'll have another GFAN call, a regular GFAN call that is scheduled for tomorrow. But we wanted to have an early one this week to talk about the 2024 results report, and the Global Fund colleagues have been kind enough to share some information ahead of time with us. And so this is what they're going to present, the idea being that it gives you a bit of time to prepare your comms around the launch of the meeting and give you a sneak peek in some of the key findings. So this is the very short agenda for the call. We'll just hear from our colleagues at the GFS, from Ernest and his team. I'll take the floor for a minute or two just to make a few additions and comments, and then we'll open for a Q&A. So very straightforward. But a reminder that all of the new figures that are being shared today around the 2024 results report are under strict embargo until September 19th for the launch. So please don't share any of this beyond the members of, beyond the people attending this call. Until then, this is really just to help you prepare and nothing else. With this, I'm going to stop sharing, and I'm going to give the floor to Ernest, thanking him and his team for, I've got a chance to look at his presentation a bit early. So it's a really good report, and I'm really looking forward to hear the presentation.
Thank you, Kanta. Do you want to share the slides for me, or do you? I share.
Yeah, so I can share the slides for you, but my internet is actually a bit unstable today. So if you don't,
let me
that'll be easier.
let me do that then.
So we have a power cut going on here, so I'm streaming
Sorry,
from my
give
phone.
me a second.
I'm a bit concerned.
I'll take care of it. Can you all see that?
Yep.
Fantastic. Thank you very much. So it's that time of the year when we come together to look at the results report. And I would again want to start by thanking all of you. Every time we share this report, it's a reminder of the power of this partnership and how we have all contributed to the results that we are going to show here. It really has taken the whole village, from civil society and advocates, governments, private sector, technical partners, communities, and the frontline health workers who every day make wake up to do the job that they do, that really contribute to the results that we are going to share here today. So thank you. Now, this report is one that really profiles the progress we have made in the last year, but also in certain elements, you will see we go back 20 years, and of course show the progress that we've made in the last 20 years, or in the last 2 decades. I want to start by talking about something new that we did in this report, to allow our audiences to access it in a more palatable manner. We have actually diced it up in a different way. Basically, it comes in the form of booklets. We have the top booklet being summary and key results. And this is Peter's letter, which sort of summarizes the report, but also maps the context. And then all the key numbers are in there. If you are to look at the printed copy, it's about 52 pages of this. And then we have standalone chapters, all of them designed in a different manner to take care of each of the diseases, but also health and community system. We also have a chapter that talks about the colliding crisis, and the chapter that talks about investing for impact. Now, and one thing that we have noticed after doing this also actually really makes the new brand that we deployed a few years ago really come to life. So that is how the report looks. Online, you will be able to collapse all this and read it all together, but it's also, divided into these different sections, which are standalone chapters. And that's the big number of the year. Up to this point, the Global Fund partnerships has saved 65 million lives. Again, we want to always emphasize that these numbers are not just mere numbers. These are people, these are parents, these are, individuals who are out there contributing to shaping their communities and their countries. The other headline numbers look like this. We have, sorry, just a minute. We have 25 million people on ARVs or on HIV treatment, 7.1 million people TB treated for TB in 2013, and 227 million mosquito nets distributed. I always want to distinguish these numbers. If you look at the HIV treatment numbers, those are cumulative. But the 7.1 million people on TB treatment, those are annual numbers. And 227 million mosquito nets distributed, those are also 2023 numbers. By the way, I can see people, writing furiously. These slides will be shared, so you will have all this. But those are the key headline numbers that we talk about. But what are the messages that we want to really come across strongly here? The first big message, besides the fact that the number we are reporting now is 65 million lives, is that 2023 was a year when our programs, HIV, TB, malaria programs across the countries where we invest, recovered fully from the disruption of COVID-19 pandemic. You will recall in the last few years, we've been talking about where we are on that trajectory. You remember the 2021 report talks about the gains that we had lost. And over the years, in the last 2 years, we've been talking about the progress we are making to recover those gains. Now we can confidently, our reports are showing we have fully recovered from that impact, and we are back on the trajectory towards ending these diseases as pandemic. Now, the other key number to highlight, and this is of interest to so many people, is how we have been able, with our COVID investments, reinvestments, really accelerate our investments in health systems. For instance, in health and community systems. For instance, in 2013, we invested $1.8 billion in health and community systems. This is a record in our investments. And of course, to mention, we are keeping that trajectory in the next 3 years, 2024 to 2026. $6 billion will go into health and community systems. That is very key. That's very important for people who are interested in seeing how that part of our investment is going. Now, what are the other headline messages? Now, connected to health and community systems, for the first time in this report, we have been able to calculate the contribution of HIV, TB, malaria in freeing up resources, or in how those investments have contributed in strengthening health systems. In fact, what we are saying, we are calling it, the right framing is freeing up resources and capacities, making health and community systems better able to respond to other diseases. It's easy to imagine that those of you who've, of course, experienced clinics, health facilities across the continent and other places or across the countries where we invest. In the older days, when HIV, TB, and malaria were, very, very out of control, these health facilities would be full of people, people seeking services. But what has happened is our investment in prevention, but also treatment that is led by community health workers, has been able to free up capacities. And we are measuring this in hospitalization. We are measuring this in outpatient visits that have been averted, but also we are measuring it in the costs that have been saved. And we have some numbers to show. 1.66 billion HIV-related hospitalizations. Now we are using HIV because, by the way, HIV is the one that is ready. We are doing it across the 3 diseases. The other 2 diseases will be ready for the investment case, which is coming up. But for now, we can show how our investments in HIV programs has been able to free up resources in those 3 categories: hospitalization, outpatient visits, but also the cost savings. Now, but it's beyond, in that same vein, the other new number that we are showing in this report is return on investments. We've been able to calculate the return on investments, and we are saying our investments, our disbursements up to end of 2023, that's $63 billion, have been able to generate health gains, monetize the intrinsic value of up to 1.2 trillion, and direct productivity gains of up to $400 billion. Now, the other key message is the fact that the other big impact we are making is our contribution in market shaping efforts, and how our market shaping have been able to really drive prices downwards. An example, of course, HIV treatment, first line HIV treatment reduced by 25%. Diagnostics for TB, 20%. To give you an example, HIV, of course, we remember there was a time it was $10,000 per year per person. These days, this is $45. And that also is reflected when it comes to mosquito nets, for instance. Now we have the dual AI nets, which are now comparable. They're supposed to be much more expensive, but because of our market shaping efforts, these mosquito nets are now comparable to the conventional ones. The other message is how we show in this report how this partnership is able to respond with agility in a world of crisis. And of course, COVID is a good example, but in many other ways, including providing emergency funds, partnering with humanitarian organizations, to be able to step up and show up for communities affected by the new crisis, by multiple crises. Of course, another big crisis is the human rights crisis. The anti-gender and anti-rights movement, and how we are able to step in and make a contribution. We have a section in this report that talks about our Breaking Down Barriers initiative and how that has been able to make very tangible contributions in breaking down human rights and gender-related barriers in the countries where we invest. Now, one of the other top-line messages is UHC. And as you see in this report, is how investments in HIV in the fight against HIV, TB, and malaria have contributed in building up, accelerating UHC. And the bigger majority of acceleration of UHC in the last 20 years can be accounted for by investments in HIV, TB, and malaria. Now, going on to the specific diseases, HIV, state of the fight, we will show how we continue to make remarkable progress in the fight against HIV, both in reducing AIDS-related deaths, but also reducing new HIV infections. You'll see this graphic is always a constant one in this report. The counterfactual, basically saying, if the Global Fund would not have been there, HIV-related deaths would have grown by 115%. Now we are seeing a reduction of 73%. If Global Fund investments or Global Fund partnership investments would not have been there, new HIV infections would have grown by 119%. Now we are seeing a 61% reduction. Of course, for HIV, we have the UNAIDS 95-95-95 targets. And you will see here, we are tracking that in this graphic. And it shows that, 84% of people living with HIV in countries where the Global Fund invests know their status. 78% of people living with HIV are receiving ARVs. And 72% of people living with HIV have suppressed viral loads. HIV is a remarkable story. It's a remarkable story of progress. Across this report, by the way, the big message is the message of progress. And that is especially epitomized in HIV and HIV programming and the progress we are making there. And these are some of the big HIV numbers. So just pick three of these. It's people on ARVs hitting 25 million, 17.9 million people were reached with HIV prevention services, 795,000 mothers living with HIV received medicine to keep them alive and prevent transmitting HIV to their babies. And a big number here that is quite one that we are very proud of the progress there is the one about PrEP. 322,000 people initiated oral PrEP in 2023. That's quite a good number. Of course, we have many more HIV numbers, HIV programming numbers that show the remarkable progress we are making in the fight against HIV. As we know, and I don't have that graphic with me here, across the three diseases, HIV is where we've made really remarkable progress. It's where we are right. We are closest to the trajectory of ending it by 2030 as compared to TB and malaria. But just to mention that across the report, what you'll also see is different case studies. For instance, and countries that really profile the progress that we are making. We highlight a few countries. For instance, when it comes to achieving the 95-95 targets, Botswana, Eswatini, Kenya, Malawi, Rwanda, Zambia, Zimbabwe. These have reached 95-95-95 testing, treatment, and viral load suppression targets. Now, we also in this report, we'll show how we are accelerating progress towards the triple elimination of HIV, hepatitis B, and syphilis. Now, another key data point is in countries where the Global Fund invests, the number of children orphaned by AIDS decreased by 26% between 2010 and 2023. This is a new data point that we have not been tracking, that we have introduced in this report, basically showing the progress we are making in terms of reducing the number of children orphaned by AIDS-related illnesses. I spoke about this data point and this graphic. It's basically a new data point that shows how investments in HIV, TB, and malaria have been able to free up hospital capacities or healthcare facilities or healthcare capacities. And we measure that in case of this graphic, we measure that in HIV-related hospitalizations, days avoided. And you, of course, see the biggest contribution or the biggest impact is in sub-Saharan Africa. You see it, of course, in other places, including Europe, Eastern Europe, and Central Asia, where we invest, East Asia and the Pacific, Latin America, South Asia, different magnitude of that, with a big contribution, of course, being sub-Saharan Africa. Now, let's move on to TB. And TB this year is a story of TB is not where HIV is in terms of the trajectory towards ending it as a public health by 2030. But what we've seen in the last 2 years, something that we have not seen in a long time, is huge momentum when it comes to the fight against TB. And you're seeing that across all indicators, across all programmatic results. But let's start, of course, by looking at the last 20 years and how this counterfactual graphic, of course, also tells the story of the fight against TB. TB deaths would have increased by 129. Now they have reduced by 36%. And TB cases would have grown by 38%. Now they have reduced by -1%. Of course, this compared to HIV is still lagging behind a bit, but the story we are telling in this report is also the huge progress we are seeing in the last 2 years in the fight against TB and why we need to seize that momentum. You see that TB treatment coverage is recovering. If you look at this graphic, you'll see the COVID dip. And when we talk about we are back on the trajectory, you see now how we have recovered from that, and we are back on that trajectory towards the 90% target that we need to get to by 2025. TB treatment success rate remains quite high, but also HIV patients, HIV positive patients, people living with HIV, HIV positive TB patients on ARVs, putting them on ARVs. That is also a great indicator. We need to be at 100%. We are at 91% at this time. Now, these are a few of the big TB numbers. 7.1 people treated for TB in 2023, as I mentioned earlier. But a few other numbers to highlight is 1.7 million people living with HIV on ARVs. That's a very key indicator. But also 2 million people exposed to TB received preventive therapy. And preventive therapy is really, really key when it comes to, of course, preventing people from getting TB. Now, a few other highlights when it comes to TB is, I think, just to mention two quick ones, is that the Global Fund is investing in innovative and novel approaches to find and treat millions of people missing with TB. And we have invested a lot in new technology, AI-powered computer-aided detection and digital chest X-rays. Now, TB is a disease where there's still a lot of underinvestment when it comes to TB tools. Whenever these new tools come into play, of course, we want to highlight those. Another key element to shine a light on here is that in 2023, our efforts extended to address post-tuberculosis lung disease And this is, of course, a challenge that people will have when they recover from TB, which has not been highlighted as much in the past. So people continue to ail or to really suffer from post-TB lung disease, and this is an area that we are really investing, heavily in. And we are reporting that in this report. Now, let's move on to malaria. Malaria is a story that, as much as we talk about progress in the other parts of this report, this is a story that we are worried about. And you'll see why. Because if you look at this counterfactual graphic, and I just want to highlight the trends in malaria cases. In everywhere else, we were saying cases would have increased, or for instance, deaths would have increased by this much. But in this case, you can see that malaria cases again, and this was the same last year, would have increased by 79%. Now they have decreased, they have increased by 2%. Now, what does that tell us? It tells us that we are not keeping up with the coverage required to stop malaria infections or malaria cases. Let me say it that way. Now, the good story here is that despite increasing cases, there's a success story there. Deaths continue to decline, even if cases are increasing. And that speaks to, of course, the success in treatment. And you'll see here very quickly, mosquito nets population coverage, we are still at around half, 57%. So we are not keeping up with the coverage that is required. Same case with mosquito nets population use. So besides coverage also, not as many people, of course, are using mosquito nets as we need them to use. But if you look at the malaria cases tested, so we are testing and treating very aggressively or very well. But again, our coverage for prevention of malaria cases is not doing as well. Other key highlights, of course, the big one is always mosquito nets distributed 227 million. But I also wanted to highlight 15.5 million pregnant women received preventive treatment for malaria in 2023, and 44.6 million children received seasonal malaria chemoprevention in 2023. SMC is a fantastic tool that we continue to invest in quite vigorously. Now, what are the other key messages when it comes to malaria? Sorry, just checking my time. Now, the dual AI mosquito nets, it's something that we are really keen to invest more in. So dual AI nets are expected to comprise 59% of insecticide-treated mosquito nets in the current ground cycle, which of course shows the ambition, because this tool is a game changer when it comes to the change in terms of preventing people using this net as compared to the conventional one. That is something we are really investing heavily in, and it's going to hit 59%, replacing the older nets in this grand cycle. But also key to mention that there are quite a few countries that are approaching elimination, at least 21 countries in Asia and Africa. We are supporting those. But also to highlight that in 2024, Cabo Verde was certified malaria-free by WHO, which is, of course, to say this battle is not lost. This fight is not lost. There are quite a few countries that continue to make great progress and eliminate malaria. Very quickly, health and community systems. This, of course, is a very important part of our mandate. And across this report, we will show how we continue to invest vigorously in health and community systems. I mentioned 1.8 billion in 2023. Much of that is there's quite a bit of a spike from C19 reinvestments. But I also wanted to mention that, when it comes to these resources, continue to prepare countries to help countries, support countries build pandemic preparedness. Now, I wanted to highlight the areas of reinvestments that I'm talking about when it comes to C19RM, funding in 5 key priority areas. That is where we've seen remarkable gains: human resources for health, lab systems, health product and waste management systems, surveillance systems, strengthening, and medical oxygen. Those are areas where we have really seen great growth. If you need to, and just to mention, the C19 reinvestments we are talking about, this is up to $2.1 billion that have been reinvested. After the emergency phase of C19, this is the money that now we are investing in health systems. Now, a few other elements, especially when it comes to our supply chains. We are big in terms of procurement, and just to remind people here, we are the biggest broker when it comes to health products, procuring $2.5 billion worth of health products each year. In 2023, we invested $202 million to strengthen supply chain systems, not just deliver product, but this in particular in terms of strengthening supply chain. But in terms of PPM, our pool procurement mechanism, we managed up to $1.3 billion across 81 countries. If you ask why the disparity there are of course countries that are able to procure from themselves. The maturity level, that's the disparity between the 2.5 and the 1.3. But through our PPM, $1.3 billion worth of products went through. Now, again, I talked about market shaping, and I mentioned these numbers. The key one there to again highlight is the 25% price reduction for first-line HIV treatment. I talked about UHC and the role that the Global Fund is playing in accelerating progress towards UHC. One nice figure here that we didn't have in the previous report, the Global UHC Service Coverage Index scored increase from 45% in 2000 to 68% in 2021. People who care so much about UHC, that's the progress we've seen in those 2 decades. Now, but here is the key thing. This improvement is largely driven by a scale up of ARVs. 61% of that is driven by, HIV treatment, scale up of HIV treatment, but also, TB treatment and mosquito nets, are 5th and 6th when it comes to main drivers of overall progress when it comes to UHC. So that's a very good data point for people who want to tell the story of UHC. Now, very quickly, as I mentioned earlier, we continue to invest in an environment that has many, many crises. And the Global Fund has shown its agility and its ability to really reprogram, to really answer to the needs of the communities where we invest, and hitting or trying to invest in all these areas where these crises are occurring. In particular, here we highlight breaking down barriers when it comes to human rights progress. We have invested since 2017, $200 million in terms of human rights, the Breaking Down Barriers program. And when it comes to gender equality, these are some of the funds. Many of you know about the Gender Equality Fund, our Voice Fund. Some of the areas where we continue to invest in terms of promoting gender equality. Now, I wanted to highlight this graphic here. This one talks about the emergency funds. and how the Global Fund continues to answer to these crises by our emergency fund continues to grow, now 130 million, distributed across all these areas: natural disasters and extreme weather events, and extreme weather and climate events, conflicts, displacement, and also political challenges. We even have, Ebola and other socio-economic challenges. Now, we wanted to talk briefly about, of course, what we are doing with climate. And this occurs, our investments in climate change, and I know this is a topic that quite a few people are interested in, can be seen in the form of adaptation measures, investments in adaptation, basically disaster risk management, vulnerability risk and impact assessment, disease surveillance and early warning system, climate sensitive disease control in vulnerable areas. But also we have adaptation measures, and there are some very nice numbers here, very good numbers here, that in the last 7 years, we have supported solarization of more than 100 health centers across 15 African countries, including Zimbabwe and Zambia. And in the new grants 2024, 2026, over 20 countries have included installation of solar panels on health or storage facilities in their funding requests. So, and that shows the kind of investments we are making in the area of mitigation. Investing for impact, very briefly, this shows the profile, the kind of investments we are making up to June this year. The Global Fund has invested 65.4 billion to fight HIV, TB, and malaria and strengthen health systems in 100 countries or more than 100 countries. Last year, again, was a record-breaking year, investing $5 billion, for the third year. Again, just to highlight public donors being our biggest contributors, but also private sector and non-governmental partners and domestic financing playing a critical role in our investment profile. Again, this is how our investments are distributed, with the lion's share or with the bigger majority of our investments, 72% going to Sub-Saharan Africa. Now, here is a new data point that we have introduced in this report this year. We wanted to ask, where does our money go when it comes to the profile of when we talk about principal recipients and people who handle the grants. And as you will see, 58%, in this case, 57% in the grant cycle 6, GC6, 57% went to governments, 31% went to multilaterals and INGOs, talk about UNDP and others. But actually, we are also able to show, for people who care about, who are thinking about localization, at least 12% of our funding is going to local entities. And that actually matches up very well with the grant cycle 5. So there's room for growth, but at least we can report that at least 12% of our funding is going to local entities. And this is a new data point that we have. Again, our distribution, the distribution of our funding when it comes to our international financing, 28%, HIV, 76% when it comes to TB, 62% when it comes to malaria. And this basically is the Global Fund contribution to international funding across the 3 diseases. You would imagine HIV, of course, has many funders, PEPFAR being one of the major ones, but many others. And that's why our profile there is much smaller. But if you look at TB, we are almost one of the only big funders because 76% of the funding comes from the Global Fund. I want to very quickly mention, and this is the last slide, how the resources available for you. Of course, the results report in English, this launches on Thursday. We also have at a glance, this is a two-pager. If you want a very, very boiled down version of what this report is about, and that comes in 10 languages. We have an interactive web page on our website. That's also going to launch on Thursday. And there you can query data and see where different countries are on the trajectory to end these diseases. We have a social media toolkit, always very popular with this group. And will come with social media tag. We have a news release that is gonna, of course, release on Thursday. We have a video, a short video narrated by community health workers and other partners across the countries where we invest. There will be a Peter op-ed that really boils down the progress we've made. There will be a slide deck, and that's the one I mentioned that will be shared. I shared that with Kanta, and I think he will share that when it's all released. And for those, of course, who worry about languages, I mentioned that we have the two-pager in 10 languages that includes French. The results report in French and the slide deck are being translated now and will come later. That will take a bit of time. They will come later in October. Thank you very much.
Thank you very much, Ernest. So we have a few questions before I move to the other questions that are a bit more about the substance. What time will the embargo be lifted on Thursday?
Lift on I would say 001. That's Wednesday, 1 minute after midnight. So basically 1 minute after midnight.
Yeah, whenever
yes.
everyone wakes up on Thursday, this is all ready to be shared. All right. Thanks. Thanks a lot. I'm just gonna stop your sharing for a second and come to we don't have a ton of time for the Q&A, so I'll be quick. But I just wanted to highlight a couple of thoughts around the report, and this was extremely comprehensive, and so obviously I will only touch on a few things. But the first is that I really want to highlight that these are, as you mentioned, the first look at post-COVID figures for HIV and the sort of full COVID cycle for TB and malaria. But a lot of the key figures on treatment, on cases for TB and malaria are, as usual, lagging behind and from 2022. And so in particular for TB, we see that there's an increase in the number of in the number of deaths compared to in the number of cases, compared to the previous year, but that's still reflecting the impact of COVID. We really welcome at GFAN the ongoing progress, especially as we see some of the figures on HIV are really, I mean, we get used to those figures and talking about millions here and there, but it really should really bring a smile to our faces and a tear to our eyes, because it's an incredible transformation from just a few years ago, and it's quite something. It's still, of course, quite heartbreaking to see that across TB, across malaria, really lagging behind, especially in malaria. As you said, there are upsides, but it's true that one really see how far we are from the targets on those two diseases, and where we really need to ramp up investment. We really appreciate at GFAN the highlight of the impact of the anti-rights movement. We really hope that the Global Fund Secretariat can take more of a lead on using its diplomatic voice, and that it's a good sign to see it's highlighted in the top line messaging of the results report. We appreciate the strong economic analysis. This is not exactly our bread and butter, but we do think this is the right tone for the times. We have conservative on the rise politically across the world, and the talk of investment, of return on investment, is really useful when engaging with some of these groups. I really like the colliding crisis framing, which is a good way to both emphasize on the ongoing priorities of a global fund, retain the focus on HIV, TB, and malaria, and avoiding some temptation to suddenly make the global fund to a green fund or a PPR fund. But at the same time, it still really highlights that we are facing growing challenges that are causing problems with regard to the fight. So these are some of my top line thoughts, but I really want to take the time to open the floor to everyone. So I'll take that down, and as I wait for hands to be raised, I'm just gonna go through a couple of the questions I will send to you, and then we'll take in questions live. So first one is whether there are any data on prep retention versus initiation, because there was a number around, I think 300K initiations, and yeah, we had someone asking around retention. Whether there's any update on the targets around pediatric HIV, because there were figures on orphans, but fewer on specifically on pediatric HIV. Whether the methodology around the savings and return on investment would be shared. And finally, whether there would be sharing of numbers around KP-specific targets, especially the 95, progress in the 95, 95, 95, specifically in key populations. So yeah, these are the ones that are, these are the first four ones. And so invite everyone to raise their hands if you have any other questions for Ernest, but if you want to take those first four.
Thank you. I hope I got all those. First of all, on methodology, yes, the report comes with what we call a note on methodology, and we explain how we calculate all the numbers. So that's going to be there in the report. The question about children, yes, this is one of the areas, in fact, one of perhaps the biggest area where we are all left behind when it comes to global investments in HIV. We are basically not treating about half the children. But as you see, and I think we mentioned that in the report, in the current grant cycle 7, there's a lot of acceleration of investments in now the more children-friendly treatment regimens. That's one of the big areas of investment, and of course, countries have been urged to come forward. The biggest challenge, as you know, for HIV treatment when it comes to children has always been on, the treatment was so user-friendly for children that it was not basically able to keep to grow those numbers there. But now with more palatable treatments, the investments are available, and those are areas where I think in the next few years we are going to see better progress. In terms of retention for oral PrEP, we don't have those numbers, but I will note your name and be able to see if that is something we can track in the coming days. But now we don't have those numbers. We have quite an element on KP specific targets, and that is there in the report. I saw a question about whether the Global Fund has grants open, and I know many of you understand that the Global Fund runs its grants in cycles, and countries are invited to come through cycles. So it's not like a grant open, but countries prepare themselves and come together every 3 years, and then deploy those for 3 years, and then you have another cycle. So I don't know whether that's clear. Any other question for me?
Yeah, so we have two hands up. Do you want to go ahead, Omar, and then we'll go with Christine?
Hello, good afternoon. Ernest, good afternoon, and thank you very much for the brilliant presentation. Ernest, I was expecting to get a data on the investment on communities affected by the diseases and the key and vulnerable population, and which I'm not sure how to call it again. I've seen the data you displayed with regards to investment, 50% or more than 50% going to the government, and 31% going to the NGOs, and 12% to others. I assume those others are the community affected by the disease or the KPs. That's my assumption. If you may correct me if I am wrong. I would like to know what are you doing to increase or to change that trend or to increase the funding or investment on the communities and KPs, because I've seen from GC5 to GC6 that area has been only 12%. It's like nothing has been done in to improve or to adjust that figure. So I just want to know, what is there anything to be done to make sure KPs or the communities affected by the disease more investment could be done on the KPs and the communities affected by the disease, and if there is any data on that and the impact it has on the whole programs. Thank you.
Thanks a lot, Omar. And before I pass it on back to Ernest, if that's okay, I'll take one more from Christine. Christine, go ahead.
Thank you, Ernest. Good evening, good afternoon. My question is, at the moment, Kenya had committed to end new HIV pediatric infections by 2027. But looking at the situation that is going on, for instance, I can give an example in Kakamega County, where by now, adolescents from the age of 9 to 29 years, they are leading in new HIV infections. And one of the things that is making us know that this target group is among the ones who are leading, it is because now you find the pregnant girls, when they attend the ANC clinics, they normally attend at the 7th month. It's when now when they go to the health facilities, it's when they're tested and they're found out to be HIV. What are we going to do about this cohort? Thank you.
Thanks a lot, Christine. So, Ernest?
Very good. Thank you. First of all, Omar, the way we have classified where our funding goes, it's by institution, government, multilaterals, and INGOs, and then, of course, local organization. I don't think, let me say, it doesn't necessarily mean that they are not, we know that there are some progressive governments that actually invest in KPs, but also we know there are quite a few INGOs and multilaterals that are also investing in that area, so we cannot use that particular classification to say that only 12% goes to KPs. We may need to look into that more closely to know what goes to KPs and communities. But just to say those numbers cannot or should not be used to say only 12% goes to KPs. One other thing to mention very quickly, when it comes to KPs and gender programming, the big specifically set aside investment that I talked about is the breaking down barriers. And it's quite a substantial amount. By all means, it's about 200 million that go to all these different programs that seek to break down barriers to accessing services for key populations. And that's one that we can look at more closely. It's at least in 24 countries right now. And that's one we can query more closely and see which countries, how it's doing in particular countries. Now, Christine, to your question, yes, AGYW is always a big challenge. It's going to take quite a few, it's collaboration between this partnership, but also governments and communities, and the Global Fund alone or this partnership alone will not do it. Governments will need to step up, communities will need to step up. And it's going to have to be not just biomedical measures. Of course, biomedical measures, we know that HIV treatment, and this report shines a light on that, HIV treatment for men and male circumcision contributes a lot to dropping infections there. But it's not just a biomedical solution. Investing in structural programs that really, support these young women and girls to make better informed decisions is going to be about their lives is going to be very important.
Thanks a lot, Ernest. I see a few comments on the no, not a few. A comment on the importance of having the KPI and community-led funding. I've shared in the chat a report that was written by the external relations team around specifically civil society funding from the Global Fund. That does not actually answer a lot of those questions for the reasons that you've highlighted, Ernest, and I know you know that report, because it looks at the type of organization and not whether they are community led and not specifically which population they serve. But it's still a useful resource to get a sense of what are the numbers like, I think. And it was also a very positive initiative in terms of transparency, and so we really encourage everyone to refer to it. I don't see any other hands up. I think we have time for one last question, and otherwise we'll be going ahead and closing the call. Once, twice, thrice.
Okay, I have a question.
Please go ahead.
Okay, the question I have to Ernest is, how I wish in Kenya you find that a lot of percentage of the global fund that you give to Kenya government, we pay a lot of money for them to transport the ARVs to health facility. How I wish that one could be their own contribution so that the money that you are giving them to transport goes back to the ARVs programs. Thank you.
Let's go ahead.
Thank you. I'm not aware of, thank you, Christine. I'm not aware of that particular element of paying. And I think in Kenya in particular, I think the principal recipient is Kenya Red Cross. I think that's a question that we could put to Kenya Red Cross. I, of course, know they work with KEMSA for distribution of health products. So I'm not aware of that particular challenge. And it's one that we could raise with the Kenya FPM. I would be very happy to connect you with the Kenya FPM. It's called Paul. So I'm gonna drop my email on this chat so that I can link you up with Paul if need be.
Thanks a lot, Ernest. And so we're reaching the end of our call. I really want to thank Ernest and the rest of the Global Fund team for first a really good report. I mean, I haven't read the whole thing yet, but the top line figures are already really interesting. And also taking the time to come and join us today. We really appreciate the efforts the Secretariat puts forward to make sure that civil society has the tools in advance so that we can support and amplify the messages and the work that is being done. Just before I close the call, I will just say that we're having another GFAN call tomorrow. We will talk about the work at UNGA around the AMR the AMR HLM in particular, and the Summit of the Future. We'll also we'll do a quick reminder around around the results report and talk about our cost of inaction reports. So we hope to see you all tomorrow. Thanks again to everyone for joining us today, and have a great rest of your day. Bye-bye.
Thank you.
Bye. Thank you.